Well, the headline number for infections in urinary tract infection in children is that in girls, around 5% of girls every year between the age of perhaps 3 and 15 will have a urinary tract infection. Important to recognise they're much commoner in girls than boys, and I would estimate that around 1 in 10 infections are in boys, so clearly a much lower frequency. As you get to the younger children, by which I mean under a year of age, urinary tract infections are less common, and in fact girls and boys have an equal frequency in that age group. The symptoms of urinary tract infections are really going to depend very much on the age of the child. So the classic symptoms would be urinary frequency, perhaps with daytime, nighttime wetting, stinging as you pass urine, possibly some blood in the urine. I think you're going to tend to find those sort of symptoms become commoner in the verbal child when they can explain what they're seeing, and as the child gets older they tend to localize the infection into the bladder. With a younger child, and I'm probably meaning here around less than a year of age, I think the symptoms are very different, and they often present with systemic symptoms. So there's more likely to be a high temperature, possibly nausea, possibly vomiting. Sometimes children don't thrive, the infections can become chronic. In the very young child, here we're talking probably less than 3 months of age, I think you wouldn't see any symptoms of a urinary tract infection in a child with a UTI, because they would have systemic features, so they would become more poorly in that age group, and that's the age group where we are particularly concerned about. That's a very debatable question. There are some people who would advocate that, and on certain websites you'll see on the internet they will encourage children to drink plenty of water, urinate frequently. You might even see some references to cranberry juice and herbal medicines. I think you would find very few doctors would advocate that approach. Antibiotics are a simple, safe and effective treatment for urinary tract infections, and particularly in the younger child, you'd want to start antibiotics without any delay. I suppose personally, as any doctor, you can offer treatment for the urinary tract infection. I think it's an important point, though, to recognise that urinary tract infections need treating. Nobody would deny that, but that urinary tract infections often or can predict an underlying problem. So when you're treating urinary tract infection, by all means treat the infection, but you have to have an awareness that in some cases, and I'm thinking here particularly younger children and particular boys, that the urine infection itself may be suggesting that there is an underlying kidney problem. So as well as treating the infection, you have to have an awareness of what may be causing it, and that may well lead to a set of investigations beyond the treatment of the urinary tract infection itself. Without treatment, I think most people would argue it would take around a week for the symptoms to disappear. With antibiotics, and this assumes that it's a straightforward urinary tract infection, you'd be expecting to see improvement within about 2 days. Complications are rare with urinary tract infections, and I think if you take, let's say the standard presentation to a paediatric clinic, a 5-year-old girl has had a urinary tract infection, there's a very low chance that the infection will cause any damage or be due to any underlying kidney problem. That's a very different scenario in a child less than a year of age, and particularly less than 3 months of age, where in those cases I think there's a relatively high risk that the urinary tract infection is secondary to an underlying kidney problem, and in that situation there is a higher risk of damage. I think antenatal ultrasound scans have been very helpful in identifying a group of children with potentially serious problems, and they're picked up early. I think children over the age of 3 are very unlikely to have any complications, long-term complications from treating a bladder infection. I think the difficult group, and I think this is reflected in the way we investigate these children, are the children under a year of age, where there may be an obstruction to the kidney, or there may be reflux of urine from the bladder back to the kidney. Those problems will predispose to kidney infections and are predisposed to kidney damage. So the management and investigation of urinary tract infections is actually very different in the younger child from the child of, let's say, school age.